Hello everyone! Today, we have a special treat. A short film that will take you on an emotional journey. Get ready to be moved and inspired as we explore the complexities of life through film. Let's dive in! Bes, bakit kaya pinagkait sa akin ni Lord of the
Bes, sabi nga nila, everything happens for a reason. Siguro may mga plano pa sa'yo si Lord.
Patient Domingo, you may now come in.
Oh, Bes, ikaw na.
Good morning, Mrs. Domingo. How are you today?
Hello, Doc. Still on recovery po. Medyo mahirap pero kailangan kong tanggapin.
Magpakatatag ka ha, kasi ganyan talaga ang buhay. Madaming mga pagsubok ang dumadating. Anyways, kamusta ka this past few days? Masakit ba yung tiyan mo or nilalagnat ka ba?
Hindi na, Doc, pero sa pag-rest ko ng isang week, madami akong realizations. Siguro hindi pa ito yung right time at may mission pa ako na kailangan kong gawin bago ibigay ni Lord ang aking hinihiling na titin.
Tama yan. Magtiwala lamang tayo kay Lord. Sabi nga nila, there will be always a right time for everything. Kaya magtiwala ka at makukuha mo rin yung hinihiling mo sa Kanya.
Yes, Doc. And naalala ko, matagal ko na pala pangarap maging healthcare provider. Dahil na din siguro sa impluwensya ko sa pagtatrabaho dito sa hospital bilang cashier.
Yes, I understand you, Angel. Kaya huwag kang bibitaw sa pangarap mo. In fact, meron akong lecture discussion about abortion, so may invite you to join since alam ko na makakatulong ito sa'yo.
Thank you for the invitation, Doc. I'm sure na makaka-attend ako sa lecture discussion.
Anyway, since 2 weeks after your DNC, you may take paracetamol if nilalagnat ka.
In life, we often hear the saying, everything happens for a reason. This idea suggests that even in tough times, there's a purpose behind what we experience. When we talk about miscarriage or abortion, it's like searching for meaning in something really hard to understand. Some people find comfort in believing that there's a bigger picture even when things seem incredibly tough. Today, we'll delve into this topic, exploring its definition, diagnostic findings, and other aspects. Abortion, a medical term, refers to any interruption of pregnancy before fetal viability, typically occurring before 20 to 24 weeks of gestation. Miscarriage, on the other hand, specifically denotes the spontaneous interruption of pregnancy. Viability marks the point at which fetus can survive outside the uterus, generally after 20 to 24 weeks. Miscarriages are quite common, occurring 15% to 30% of all pregnancies. They are classified into early miscarriages, occurring before the 16th week, and late miscarriages, occurring between the 16th and 24 weeks. Placental attachment during pregnancy progresses from tentative attachment to the decidua before 6 weeks, to moderate attachment to the myometrium between week 6 to 12, and finally, deep and penetrating attachment after week 12. Clinical presentation often includes various bleeding patterns, with bleeding typically being less severe before week 6 and becoming more profuse after week 12, due to the deep implantation of placenta.
Now we're exploring the different causes of abortion using the acronym ABORT. Each letter represents a different factor contributing to this event. Let's break it down and understand why miscarriages happen. A stands for abnormal fetal development, most frequent cause in the first trimester. 50% up to 80% of early aborted fetuses have structural abnormalities. B represents bleeding due to implantation abnormalities, where issues like inadequate endometrial formation or inappropriate implantation size compromise placental circulation and fetal nutrition. O indicates the ovary's failure to produce sufficient progesterone, impacting the maintenance of decidua basalis. R signifies the recurrent systemic infections such as rubella and syphilis. Finally, T highlights the influence of teratogenic drugs like isotretinoin and alcohol consumption during conception.
Moving on to the assessment. Vaginal spotting, often the initial signs of abortion, occurs due to the light bleeding or spotting from the vagina and lower abdominal cramps or menstrual cramps. Additionally, fever and body malaise may manifest, suggesting the presence of infection, particularly in cases of incomplete abortion or retained products of conception. These symptoms including elevated body temperature and feelings of illness or weakness. So, moreover, signs of infection such as increased abdominal pain, foul-smelling vagina discharge, and flu-like symptoms. In the assessment of abortion, healthcare providers employ various diagnostic methods to gather essential information and determine appropriate management strategies. So, ultrasound examination serves as a fundamental tool enabling confirmation of pregnancy and assessment of fetal viability. Blood tests, particularly quantitative measurement of human chorionic gonadotropin or HCG levels. So, next is the tissue examination involving the analysis of past tissue fragments from the uterus. Offers further diagnostic clarity by identifying structural abnormalities or genetic anomalies contributing to the abortion. Additional tests including blood typing, hormone level assessment, or genetic testing may be employed as needed to comprehensively evaluate underlying factors and tailor management approaches accordingly.
Now that we have discussed the concept of abortion, let's move on to different types of abortion. First is the threatened abortion. It presents with symptoms such as scant vaginal bleeding and slight cramping while the cervix remains closed. To manage this condition, patients are often asked to visit the clinic for fetal heart rate assessment or ultrasound to evaluate fetal viability. Monitoring of HCG levels is also recommended. Additionally, patients are advised to avoid strenuous activity for 24 to 48 hours. Coitus is typically restricted for 2 weeks. Dilation and curettage may be performed to remove any retained products of conception. Second is the imminent or inevitable abortion. It is characterized by cervical dilation, uterine contraction, moderate vaginal bleeding, and severe or painful cramping with cervix typically open. In such cases, patients are advised to visit the clinic and bring any tissue fragments for examination. Vacuum extraction may be performed to remove retained products of conception. Following discharge, patients are instructed to monitor vaginal bleeding by recording the number of pads used, allowing for ongoing assessment of post-abortion bleeding. And next is a complete abortion. In a complete abortion, all products of conception are spontaneously expelled without resistance from the uterus. And next is a complete abortion. In a complete abortion, all products of conception are spontaneously expelled without resistance from the uterus.
In a missed or early pregnancy failure, the fetus dies within the uterus but is not expelled. To manage this, ultrasound of fetal demise is essential. Following confirmation, dilation, and evaluation is commonly performed to remove the non-viable pregnancy. In cases where the pregnancy has progressed beyond 14 weeks, prostaglandin suppository or the misoprostol may be administered to dilate the cervix, followed by the oxytocin stimulation or misoprostol to facilitate uterine contraction. Recurrent pregnancy loss once labeled habitual aborters affects roughly 1% of women aiming for pregnancy. Potential causes include issue with sperm or egg quality, uterine abnormalities, or infections such as chorioamnionitis.
Complications following abortion can pose serious risks to women's health and require vigilant monitoring and intervention. One significant complication is hemorrhage, may require interventions like DNC and transfusion. Infection signs like fever and abdominal pain need close monitoring. Septic abortion demands immediate treatment to prevent life-threatening conditions like toxic shock syndrome or septicemia.
Medical management.
Medical management of abortion involves various procedures aimed at safely terminating the pregnancy or managing its complications. One common approach is vacuum aspiration, which can be performed manually or with an electric device. This procedure entails the gentle suction of uterine contents under local anesthesia and is typically carried out during the early stages of pregnancy, usually up to 14 weeks. Another method is dilatation and curettage, a surgical intervention that involves dilating the cervix and scraping the uterine lining to remove the pregnancy tissues. DNC is often employed in cases of incomplete abortions or to address complications arising from the termination of pregnancy.
Pharmacologic therapy for abortion involves several medications aimed at inducing uterine contraction and expelling the uterine content. Mifepristone, an anti-progesterone medication, is given orally to break down the uterine lining and detach the embryo. This is typically administered a single 200 mg dose. Misoprostol, another common medication, is used to induce uterine contractions and facilitate the expulsion of uterine content. It can be administered vocally or vaginally. Metrosinate, which inhibits the cell growth, is given orally or intramuscularly to terminate the embryo. Prostaglandin analogs are also utilized to induce contraction for uterine content expulsion, often administered vaginally or intramuscularly. This medication may have side effects such as nausea, cramping, and bleeding, and their use is contraindicated in certain conditions such as ectopic pregnancy or allergy to medication.
In nursing care management for abortion, several key actions are essential to ensure patient safety and emotional well-being. Firstly, nurses must execute appropriate management strategies to prevent complications, closely monitoring vital signs, bleeding, and pain levels. Positioning the patient's bed in Trenton and Birch position, if ordered, can aid in management. Thorough documentation of intravenous fluids, laboratory tests, and preparation for any emergency surgical interventions is crucial. Additionally, nurses play a pivotal role in offering emotional support and counseling to patients, assisting them in developing effective coping strategies. For Rh-negative mothers, preparation and administration of Rogam are necessary while advising iron supplementation to address potential deficiencies. Patients should be advised to refrain from sexual intercourse until their next menstrual cycle and encouraged to ensure barrier contraception. Lastly, scheduling follow-up visits within 2 to 4 weeks ensures continued monitoring and support for patients' recovery
In
process.
summarizing our report on abortion care, it's crucial to recall the mnemonic abortion. A represents assessing the age before viability of the fetus. B signifies monitoring for signs such as bleeding, cramps, and fever. O emphasizes the observation for potential complications like infection and hemorrhage. R underscores the need to record vital signs and bleeding patterns. T highlights the risk of serious complications such as toxic shock syndrome. I denotes interventions such as administering Rogam and providing iron supplements. O prompts consideration of ovarian function and progesterone levels. Finally, N emphasizes the recommendation to have no sexual intercourse and promptly informs the healthcare provider for any concerns. As we wrap up our report, we extend our sincere thanks for your time and attention. We hope that you've gained valuable insights and knowledge that will stay with you. Remember, learning is a continuous process, so let's keep exploring and discovering things.
Bes, alam mo ba, napag-desisyonan ko na ipagpapatuloy ko pala ang pangarap kong maging nurse.
Maganda yan, Bes. Kaya mo yan. I-slay mo ang nursing.
Bes, parang gusto ko magtanim ng tree bilang ala sa akin.
Tara, Bes. Maganda yan. Para sa'yo at para na rin sa ating anghel.
Even though we'll never get to hold you, you will always be part of us.
You were so loved, little one.